This is the structure of COVID-19. The name coronavirus comes from the Latin word corona, meaning crown or halo. Under an electron microscope, it looks like it is surrounded by a solar corona. The novel coronavirus, identified by Chinese authorities on January 7 and since named SARS-CoV-2, is a new strain that had not been previously identified in humans. Based on their genomic sequencing analysis, scientists concluded that the most likely origins for SARS-CoV-2 followed one of two possible scenarios. In one scenario, the virus evolved to its current pathogenic state through natural selection in a non-human host and then jumped to humans. This is how previous coronavirus outbreaks have emerged, with humans contracting the virus after direct exposure to civets, SARS, and camels, MERS. The researchers proposed bats as the most likely reservoir for SARS-CoV-2, as it is very similar to a bat coronavirus. There are no documented cases of direct bat-human transmission, however, suggesting that an intermediate host was likely involved between bats and humans. In the other proposed scenario, a non-pathogenic version of the virus jumped from an animal host into humans and then evolved to its current pathogenic state within the human population. Like all viruses, the mission of SARS-CoV-2 is to use the mechanisms of human cells to make copies of themselves. The tricky task is finding a way into the cells where they can replicate. The novel coronavirus, SARS-CoV-2, isn't particularly good at that. Research so far suggests that it sneaks in through a single cellular door, a membrane protein called ACE2. The virus that causes COVID-19 can latch onto the ACE2 receptor undetected, likely because of its animal origins. The adaptive immune system, the part that creates antibodies that help identify pathogens quickly, hasn't had a chance to learn what SARS-CoV-2 looks like yet. This means the virus can use a molecular phishing scam to sneak into the cell. Once it does, the cell is doomed. SARS-CoV-2 takes control of the cell's genetic reproduction tools, relentlessly replicates itself, and bursts through the cell wall. The COVID-19 virus affects different people in different ways. COVID-19 is a respiratory disease, and most infected people will develop mild to moderate symptoms and recover without requiring special treatment. People who have underlying medical conditions and those over 60 years old have a higher risk of developing severe disease and death. Common symptoms of COVID-19 include fever, tiredness, dry cough, shortness of breath, aches and pains, sore throat. And very few people will report diarrhea, nausea, or a runny nose. People with mild symptoms who are otherwise healthy should self-isolate and contact their medical provider or a COVID-19 information line for advice on testing and referral. People with fever, cough, or difficulty breathing should call their doctor and seek medical attention. To prevent infection and to slow transmission of COVID-19, do the following. Wash your hands regularly with soap and water or clean them with alcohol-based hand rub. Maintain at least 1 meter distance between you and people coughing or sneezing. Avoid touching your face. Cover your mouth and nose when coughing or sneezing. Stay home if you feel unwell. Refrain from smoking and other activities that weaken the lungs. Practice physical distancing by avoiding unnecessary travel and staying away from large groups of people. Thank you for watching. And stay safe.